Morning. My name is Juan Antonio Asensio. I am currently the Vice Chairman, Department of Surgery, New York Medical College. I am the Chief of the Division of Trauma Surgery, Surgical Critical Care, and Acute Care Surgery. I'm also the Director of the International Medicine Institute and the Co-Director of the Trauma Research Institute at both New York Medical College and Westchester University Medical Center in Valhalla, New York. I think some of the proudest moments of my career are really having received honorary fellowships in so many different surgical societies from all over the world. I've just been informed I've been made an honorary fellow of the Italian Surgical, Japanese Surgical, Argentinian Surgical, Royal College of Surgeons of England, the Mexican Surgical, Japanese Surgical. Those are extremely proud moments for somebody who came up from a very humble background. However, no matter how many honors I have received in my life, I still go back to being the kid that used to drive cabs here in the city of Chicago. We are currently editing the 6th edition of Current Concepts from Trauma and Surgical Critical Care. This textbook was originally edited by none other than Don Trunke, who's really the world's dean in trauma surgery. What Dr. Trunke has achieved has been tremendous. His achievements are all too numerous to count. He has been a beacon for all of us as trauma surgeons in America and in the world, as well as Frank Lewis, his former partner at the University of California, San Francisco. And Frank Lewis now currently sits as the Executive Director of the American Board of Surgery, a tremendously prestigious surgeon. Subsequently, I was given the privilege of becoming the first editor of the book with Dr. Trunke. And what we did with this textbook is to continue a tremendous tradition, really, that was born out of the influences that Don Trunke acquired when he was Dr. Shires, Tom Shires, one of America's greatest surgeons, when he was his first trauma surgery fellow at Parkland way back when. This fellowship also counted other prestigious surgeons such as Dr. Lou Flint, Dr. Jim Carrico, and many years after them, I came afterwards. So the textbook has evolved into, I think, a tremendous textbook. It's a textbook that really covers the true practical operative experience and operative technique that many other books do not cover. It has been received worldwide. We're going to have in the future contributions from many of our colleagues from the international arena. The 6th edition is going to feature a tremendous number of operative drawings, actually line drawings, as well as color photographs of many of the operative procedures that we have practiced or experienced or have practiced for many years. We've obviously want to make sure that we preserve the tradition of excellence in operative surgery that American surgeons have pioneered and led throughout the world. It is a very scientific textbook, and we hope to duplicate and continue to improve that effort. We're also in the process of publishing an operative atlas on trauma surgery and acute care surgery that I have the pleasure of working with my distinguished colleague William Chiaffi. Him and I are the two main editors, and we have other tremendous contributors, including Dr. L.D. Britt and Jerry Jerkovich, again, extremely well-known surgeons that have contributed tremendously to American surgery. The electronic media obviously has revolutionized the education in surgery. Electronic media is great, is very portable. It has allowed us to reach many people.